Today we're going to look at a program called Virtual ECG by ViziTech USA. It's comprised of 3 separate modules. The modules work from left to right in a progressive manner. The very first module is something called Electrode placement. It helps the user practice in placing the electrodes on the human body. And so whenever we place an electrode, we can see that where that placement exists can be very exact. And so whenever we place that electrode, we want to place it in a proper position to be able to measure an ECG. What would normally happen is a user would put their finger on the chest of the individual and feel for the intercostal spaces. And what we have inside of the program is controls to help us discover where those intercostal spaces are that are described on the left, as well as the clinical instructions of where to put those on the right. So whenever we look at the application, the clinical instructions show us where to place those. We turn these indicators off. We can now see that if we turn off skin and turn off muscle, that intercostal space is now there from 1, 2, 3, 4. And if we turn on the indicators, we can see that it's almost right on top of the indicator where it goes for V1. If we were to tilt the individual, we can see by tilting it where those electrodes are placed spatially on top of the individual. So electrode placement is a very important part of how a proper ECG is measured. This module 1, allows you to practice over and over and over again the proper placement of each one of the ECGs, either through guided placement or through non-guided placement, being able to practice putting those electrodes in place. So that's Module 1. Module 2 allows us to understand the theoretical distinction of what is an ECG electrode. Whenever we look at an ECG electrode, some people have thought that the ECG electrode is a wire or an electrode that goes on the body itself. It's not. It's not a piece of hardware. It's a measurement vector that goes through the heart itself. Whenever we look at these readouts, we can see that V1 is portrayed there, and it highlights V1 vector going through the heart. Now, if we pull the front of the heart away, we can see that V1 electrode is going through the center of the heart, and it's measuring what's called the septum, or the septal wall. V2 is in a similar region. Look at AVR, AVF. Each one of them are highlighted to show you what region of the heart is being measured. Now you can bring this heart a little further out, and by leaning into the display itself, you're able to see a clipping plane that looks at the interior structure of the heart where each one of these exists. So when we put the heart back where it was originally, we can turn on the rotate and see it from different perspectives, and we can also turn on the instructions. These controls over here help you understand what you can do to facilitate the tasks inside of this module. The instructions on the right help you understand the goal of this module. Looking at Module 3 helps us understand that there are regions of the heart that are measured to help us understand what conditions exist. So we look at the inferior wall, for example, as a heart condition. We see that lead 2, lead 3, and lead AVF are used to measure that region of the heart. Again, if we open up the heart, we can see that there's a region of the heart that's being measured explicitly by the combination of those 3 leads. Now those leads show you that the specific electrodes that comprise that measurement are on the upper right arm, the upper left arm, the lower left leg, and that's showing you how these are actually being measured by electrode. But again, the lead is the measurement vector that goes through the heart itself. Another example is when you look at the septal wall condition, you see that V1 and V2 are being used to measure the condition of the septal wall inside the heart itself. And so by looking at different conditions on the heart, you can understand which combination of leads help us understand what electrical activity is either normal or abnormal in that region of the heart. So that's Module 3. So we've looked at all 3 modules. Module 1 is electrode placement. Module 2 helps us understand that a ECG lead is not a piece of hardware. It's a measurement vector through the heart. Module 3 helps us understand what conditions correlate to which leads are being used, and the accuracy of the leads correlate to how well you have placed the electrodes on the body inside of module number 1. So this has been an overview of the virtual ECG program by ViziTech USA. Thank you.